And some promising research in the fight against cancer is underway at the University of Connecticut. It may soon help patients battling cancer before a tumor even starts to grow. It's amazing. Lisa Carberg has a story you'll see on Just One Station.
JoAnn Marrero is one of the lucky ones. When she got a breast cancer diagnosis last year, it was in the early stages of the disease.
I think my prognosis is very good.
Catching cancer early can dramatically improve a patient's prognosis.
You just injected some of those beads?
And as a result of the research happening inside this UConn lab, doctors may eventually have the ability to detect various cancers sooner than ever before.
There's a big interest now in these proteins called biomarkers that increase in concentration in blood when people start to get cancer.
Professor James Rusling and his team are studying prostate and oral cancer biomarkers. He says doctors do currently screen for single biomarkers in the blood, but the testing's not that accurate. That's where this research differs. These scientists are looking at a combination of biomarkers.
It can facilitate new treatments, and it can facilitate treatments that can be used and avoid surgery, for example, because what these biomarker proteins can do is tell whether somebody has a problem that's going to lead to cancer in the very near future. So even before a tumor is evolves.
Dr. Molly Brewer, a gynecological oncologist, treats women with various reproductive cancers. She says early detection is the most powerful tool in the fight against cancer.
It's more curable. If you detect a small lesion, you can cure it. If you detect a lesion starting metastasized, your chances of curing it are less.
Additionally, if biomarkers can find cancers early, there will be less patients needing treatment such as chemo and radiation.
Chemotherapy, radiation, they're all fraught with complications. And patients get sick, patients feel bad, they may be out of work. And so if you could avoid all of those, that would be 1,000 times better.
The big question now, when might this testing be available to patients?
Depends on lots of things, but maybe 5 to 10 years it'd be possible to have a device in some type of form that it can be used.
Anything that can detect cancer sooner sounds good to JoAnn. She's finished with treatment and focused on enjoying life.
I appreciate things a lot more, or I should say I don't let things bother me. It's, the daily stuff.
Lisa Carberg, NBC Connecticut News.
And by the way, Professor Rusling has been researching cancer biomarkers for the last 5 years in conjunction with the National Institute of Health.